Get started. Okay, well, I want to welcome everyone to this webinar for our Clinical Informatics Subspecialty Fellowship at OHSU. My name is Bill Hirsch. I'm a professor in the department. I was the original program director, but Dr. Mohan has assumed all those activities from me now. And the way that we'll run this webinar today is that I will kind of give a big picture overview of the subspecialty, and then we will transition into more detail about the subspecialty fellowship that we offer at OHSU. So probably most of you who are attending this know what clinical informatics is, but just as a level setting, in case there are those who don't or who need to refresh, as defined by the Accreditation Council for Graduate Medical Education, or ACGME, which accredits residency and fellowship programs, and I actually think is a pretty good definition of the field. Clinical informatics is the subspecialty of all medical specialties that transforms healthcare by analyzing, designing, implementing, and evaluating information and communication systems to improve patient care, enhance access to care, advance individual and population health outcomes, and strengthen the clinician-patient relationship. So it's about technology, but it's about a lot more than technology. It's really about using that technology to advance the health and well-being of patients and clinicians and others who take part in healthcare. So the subspecialty is set up as a subspecialty of all primary specialties. So whether you are a physician who is originally trained in specialties like internal medicine, family medicine, surgery, radiology, pathology, etc., you can become a subspecialist in clinical informatics. The one downside to this approach is that those physicians who don't have a primary specialty, or perhaps they trained some time ago and let their specialty certification lapse, are not eligible to become part of the subspecialty. So in the last decade and a half or so, there has been a tremendous wealth of opportunities in clinical informatics. It perhaps started around 2009 with the passage of the HITECH Act, which led the US government to invest over $30 billion in incentives for adoption and the so-called meaningful use of electronic health records. But that's not all of it. The National Institutes for Health, which funds biomedical research, launched its Clinical and Translational Science Award, which funded infrastructure that aimed to accelerate the translation of biomedical research into practice. And of course, to do that, there's a substantial involvement for informatics, and the CTSA program has really galvanized a related field called clinical research informatics. Informatics also has an important role to play in the area of precision medicine, where we make use of genomics and other more precise ways to diagnose and treat disease. The US government has also invested a fair amount in precision medicine, and what was originally called the Precision Medicine Initiative is now the All of Us Initiative. There's also just the growing use of electronic health record, really the growing use of data from not only electronic health records, but other sources, wearables, social media, et cetera, et cetera. And the importance of standardizing that data using protocols such as Smart on Fire, and also leading to the development of advancement of machine learning. We also saw a substantial involvement of informatics during the COVID-19 pandemic. Fortunately, the public health emergency has now ended, but COVID still lives with us, and we must keep track of it. And it's also changed the way that a lot has happened in the world, including more virtual work, more use of virtual clinical care such as telehealth, There have also been many data initiatives, not only to keep track of COVID, but also prepare for any future pandemics. And then we're now on this cusp of artificial intelligence, or AI, which has actually been around in medicine for many decades, actually into the last century, but has really come to the fore with the development of machine learning and related areas, and the massive growth of data. So a little history about the subspecialty. The subspecialty began around 2009 when the American Medical Informatics Association, or AMIA, chartered a couple documents. One was a core curriculum for informatics. The other was training requirements for what would become the subspecialty fellowship. The core curriculum served for many years as the blueprint for the board exam, although it became out of date and has been replaced by another blueprint, which I'll mention momentarily. In 2011, the American Board of Medical Specialties actually approved the plans that AMIA had developed, and the American Board of Preventive Medicine, or ABPM, stepped forward to become the main administrative home, with some additional involvement by the American Board of Pathology, but ABPM is the prime board. Now, one does not need to be board certified in preventive medicine. ABM is the administrative home, and they handle the application of all physicians, with the exception of pathologists, to become board certified in clinical informatics. A couple years later was the first certification exam offered by ABPM, mainly with some help from ABP. And the exam was offered by what is called the practice pathway, which is soon coming to an end, I will mention in a few moments. But this is sometimes called grandfathering when there's a new medical specialty or subspecialty, and those already working in the field, if they meet certain qualifications, can sit for the board exam without doing a formal fellowship. That started in 2013. It was just when the first exam was offered, and the ability to get board certified was developed at that time. There was also the launching of the Clinical Informatics Board Review course by AMIA, our professional association, and some of you may know I'm the director of that course. And 456 physicians signed up to take the exam, or I'm sorry, it was more than 456. 456 physicians passed the exam. It had a fairly high pass rate that first year, probably reflecting that most of the people taking it were already practicing in informatics for many years. And that first cohort of individuals passing the exam included 7 faculty from OHSU, including myself and Dr. Mohan, and several others. In 2014 was when the fellowship accreditation rules were released, and 4 programs applied to become accredited and achieve that status, including OHSU. One program, our colleagues at Stanford actually launched that year. We launched the following year. And in 2014, another 329 physicians passed the exam to become board certified. The next year, there were more programs applying to become accredited, 15 total, and 3 of the first 4 others launched, including OHSU, in 2015. So we had our first clinical informatics fellows in 2015. In 2016, since the number of fellowship programs was still small, the ABPM made the decision to extend the practice pathway another 5 years. This is something that's not uncommon in new specialties or subspecialties. So now it was extended to 2022, which was last year. In 2019, as individuals continued to take the board exam, including the first few graduates from the fellowship programs, the number of board certified surpassed 2,000. And in 2021, the practice pathway was extended again, although this will more than likely be the last time that that's done. The rationale for extending it was the disruption that occurred to the fellowship programs and people preparing for the board exam, et cetera, during the COVID-19 pandemic. So into this year, we now have about 55 programs. There's new programs coming online every day, so there may be slightly more than that now, but 55, a minimum of 55 programs accredited and launched. And our program, with the graduates who just completed our program or who are completing our program at the end of June of 2023, will increase our numbers to 20 graduates of our fellowship program. Many of whom have gotten jobs that combine their clinical work and informatics, and we're very proud of what our graduates have accomplished. All but one graduate who's taken the board exam has passed it. And our program, because our courses are online, a number of other programs at any given time, about a half dozen other fellowship programs use our courses. And I'm just estimating here, it may be slightly more than this, but about 30 fellows from other programs have taken courses in our program. So looking to the future, 2025 will be the last year of the practice pathway, and then starting in 2026, the only way to become board certified will be through an ACGME accredited fellowship, which we at OHSU have mixed feelings about, because we have had many individuals who completed our master's degree and gotten very rigorous training in informatics, but won't be able to become board certified unless the ABPM adopts, which a few subspecialties have, a kind of more virtual approach to fellowship, but it's not clear that that will actually happen. These are just the numbers. I keep this slide because mainly I put it up in the board review course. But as you can see, the pass rate has been dropping a little bit in recent years, probably reflecting the fact that many of the early exam takers had a long history of working in the field. And so you see that we now have, through the end of the people who have taken the exam in 2022, 2,787 board certified clinical informatics subspecialists. And the exam is offered by ABPM each year in October, so we'll presumably have another couple hundred, maybe we'll hit 3,000 during the 2023 exam year. So what do clinical informatics subspecialists actually do? Probably the most common role that they play in healthcare organizations, including in academic medical centers, is operational. So sometimes we almost talk about the chief medical or chief health information officer being almost like a prototype role for a clinical informatics subspecialist, but there are other roles. And for example, we actually have associate CHIOs in our system. There are other operational roles. They go by different titles. And I list some people here that are part of our program at OHSU. Other clinical informatics subspecialists get involved in research. Here at OHSU, Dr. David Dorr is OHSU's Chief Research Information Officer, or CRIO, and he is board certified and also touches over into some of the operational aspects, mainly related to research information systems. Other clinical informatics subspecialists like myself and Dr. Mohan end up in more academic pursuits. So in research and or education. And then others have more specialty specific roles. And again, from OHSU, Dr. Eilish Boudreau, who actually is the site director for our Portland VA part of our fellowship, is a neurologist, and Dr. Ben Orwell, an early graduate of our program, is a pediatric intensivist. And these individuals also play various roles, not only in our fellowship program, but they're also involved in research programs. Dr. Orwell's involved in some operational activities at OHSU Hospital as well. So another way to expose what clinical informatics practice is about is to look at a paper that was published that was a workforce analysis published by AMIA in 2019 of basically interviewing all kinds of different people who worked in clinical informatics. And you can break down their work. I won't go into a lot of detail here, but their work involves, for example, that first domain, having a fundamental knowledge and skills just about informatics and healthcare in general. The second domain, improving care delivery and outcomes, so things like clinical decision support, population health, things like that. Domain 3 is enterprise information systems, so all the major information systems in healthcare organizations, probably of which the electronic health record is most central. But there are many others. Certainly, we've seen the growth of telehealth during the pandemic. The fourth domain, which was not its own domain in the original core curriculum outline, there were only 4 domains, but this analysis identified a fifth domain, which is domain 4, called data governance and data analytics. And this is all about data. And certainly with the growth of data science and AI and related areas, this area has become very central to clinical informatics practice. And then finally, the fifth domain, informatics is not just about computers or even data. It's also about what we sometimes call management and professional issues or people and organizational issues. That's what I was looking for. They're critical. Hospitals are very complicated socio-technical environments where there's a lot of interaction between the technology and the people, and leadership and professionalism are critical. Our program at OHSU is a national leader. As already mentioned, we have been offered online courses for over 2 decades. We have almost 1,000 alumni in our program. We have students who are spread out not only across the United States, but also in other countries. And sometimes they have come to study on our campus. Others have taken courses online because the internet knows no boundaries. And so we just list here some of the countries that we have had various kinds of collaborations with. You see the numbers, the little table up in the upper right, which shows the degrees and certificates, graduate certificate, master's, PhD, mainly in what we call health and clinical informatics, which is the curriculum that most fellows take. We have another second program, a smaller program, bioinformatics and computational biomedicine. And you also can see a picture of a bookcase that sits outside my office that actually has just a subset of the bound volumes of theses and dissertations and capstone projects, etc. We actually don't require these to be printed anymore, but the bookcase, and actually now there's currently a second bookcase right next to it, which is almost full, shows how productive our fellows have been. So DMICE, our department, the Department of Medical Informatics and Clinical Epidemiology, has a lot of activities going on at OHSU. Our fellowship program is central to our graduate program, but we have graduate students from beyond medicine in other health professions, in technology professions such as computer science and data science, even some beyond those. Also mentioned earlier that several other clinical informatics fellowships make use of our courses, which can make for a nice virtual cohort. So the fellowship program uses a match that fellows get assigned to programs that they rank. And so even if you don't end up at OHSU, you may still be an OHSU student by taking courses. Another source of opportunity in our department is research. We receive about $12 million per year in grant funding. mostly from government entities, the National Institutes of Health, which includes the National Library of Medicine, the Agency for Healthcare Research and Quality, Office of the National Coordinator. We also get some state, industry, nonprofit foundation, and professional society funding for our research. And we've also been busy making sure that our curriculum is up to date with the ever growing amount of changes in data science and AI. And in fact, we even have some funding from the National Institutes and the National Library of Medicine to support the revision and updating of our curriculum. And this, I think, is my last slide. DMICE doesn't live in a vacuum at OHSU, and we are involved in other parts of the university. One important part is the MD curriculum, so the medical student curriculum. Our department is in the School of Medicine, and we have been playing a major role over the years in adding and enhancing clinical informatics for medical students. Since 21st century clinicians need to be proficient in clinical informatics. And we have actually played a national leadership role, mainly through some grant funding several years ago from the American Medical Association Consortium for Advancing Medical Education. I mentioned earlier the CTSA program. OHSU's CTSA Center is the Oregon Clinical and Translational Research Institute, or OCTRI, also sometimes pronounced Oak Tree, which has core funding for research infrastructure, including research informatics. OHSU has a very prominent cancer institute, the Knight Cancer Institute, named after Phil Knight, who for many years was the founder and then CEO of the Nike Corporation, which is the largest homegrown corporation in Oregon. And in his later years has been very generous with his money philanthropically. And about 7 or 8 years ago, basically issued a challenge to OHSU. If you can raise $500 million in philanthropy, I will match it. That happened. And so the Knight Cancer Institute is a very well-known cancer institute, has a research building on the waterfront on the Willamette River in downtown Portland. And then another initiative is our strategic planning. A few years back, we had a new president arrive, Dr. Danny Jacobs, who's still the president, and he set out to do some strategic planning to look at some strategic areas that OHSU should invest in. Some of this was sidetracked a little by the COVID-19 pandemic, but there actually has been some investments that have gone forward, including those related to informatics and providing opportunity for our fellows and students and faculty. So I will stop sharing at this point and turn it back either to Lauren or to Dr. Mohan.
Yeah, thank you, Bill. And so Dr. Hirsch gave us this excellent kind of broad overview of DMICE and its position in OHSU and the and the role that OHSU plays in informatics education nationally and internationally. I'm going to come down in altitude a little bit and give you a bird's eye view of the program itself with some granular details about it. My name is Vishnu Mohan. I'm the program director here for the OHSU Clinical Informatics Fellowship Program. I'm also faculty here at DMICE. Before I was faculty, I used to be an academic clinician educator in internal medicine until I took Bill's course and discovered that I was addicted to informatics and slowly mutated into an entirely new species of human being. Next slide. So DMICE, as Bill mentioned, is the Department of Medical Informatics and Clinical Epidemiology. It's comprised of 3 loose divisions. Also, there's a lot of collaboration between folks in these loosely affiliated divisions. There's the Health and Clinical Informatics group, which do more clinical informatics work, operational work, and clinical informatics research. They're the folks who do bioinformatics and computational biomedicine. And then there's also the folks who do clinical epidemiology. That's the Evidence-Based Practice Center, which is responsible for a number of evidence-based recommendations for best clinical practices for a number of specialties. And together, the health and clinical informatics, bioinformatics and computational biomedicine, and clinical epidemiology folks comprise of DMICE, which is the Department of Medical Informatics and Clinical Epidemiology. Next slide. So this is a picture of OHSU as it is now. This is the main campus on Markham Hill. There are also two other campuses on the right. There's this large campus down on the waterfront near the Willamette River that Dr. Hirsch mentioned, which has our medical school, main medical school building, and also additional clinical buildings, and also our main research building for the night cancer. There's also a West Campus on the west side of town, which hosts some of our advanced computing resources and also a primate center. But the main campus and the oldest campus is on a hill called Markham Hill. The yellow arrow points towards Mackenzie Hall, which is one of the oldest buildings on the OHSU campus, also known as Mac Hall, and the red arrow points towards BIC, which is the building in which DMICE has a home. Next slide. And then back in 1997, you can see this picture. The yellow arrow, it's in the distance, but the yellow arrow points to Mac Hall. BIC was still around in 1997, but right next to BIC, where now there's the big biomedical research building, there's literally, green space where they were just going to build the building, which is when it was built. And then to the right of that is the hospital itself. In the foreground, you can see the VA, which is connected by this super cool sky bridge from the OHSU campus to the VA. And in the background, you can see the city of Portland. Next slide. And then back in 1962, this is OHSU as it looked then. The hospital is on the right. The yellow arrow points to Mac Hall, but there was no BIC at that point, and the campus was still very small compared to what it is now. And if you look at the distance, you can see the industrial units and shipbuilding facilities that lined the banks of the Willamette River, which now is all kind of built up into the South Campus and mixed residential areas. Next slide. And going all the way back to 1929, this is my last historical slide, I promise. The yellow arrow still points towards Mac Hall, which is still there. But as you can see, at that point, the campus just consisted of a few buildings. It was still pretty new, even though the history of OHSU extends back into a few years prior to this, to when this picture was taken. The point I want to make is that OHSU has been around for a long time. Informatics is a new specialty, but the Department of Medical Informatics has been around for a long time by informatics standards, and clinical informatics is a new specialty of medicine, but the CI fellowship program at OHSU has been around for as long as the specialty has been around, because we were one of the first programs to be accredited by ACGME. Next slide. So in a couple of slides, I tried to put together why you should consider the CI fellowship program at OHSU. We're a really large informatics department with faculty who are engaged in a variety of activities here at OHSU and beyond. There are many informatics programs, educational programs here at DMICE. We have a graduate certificate programs. We have a master's with thesis. We have a master's without thesis, PhD program, and also the National Library of Medicine sponsors pre- and postdoctoral programs at OHSU. We also are part of the MD PhD program here at OHSU. And so there's a number of educational offerings, of which the ACGME accredited Clinical Informatics Fellowship is just one offering in a family of educational programs here at DMICE. And there are many students on campus, less now, that we're in the new post-COVID norm, but definitely pre-COVID, there were a significant number of students on campus. So it's not just the CI fellows who are on the campus. There are other educational activities and other learners on the DMICE and OHSU campus. I mentioned that we were one of the first programs to be accredited by ACGME. That first year, there were only 4 programs, and now there are well over 55. I think, even more than 55 now. We have a well-organized program structure. One of the advantages of being around for such a long period of time is that we've had time to iteratively improve the way that the program is structured, and our administrative framework is well tested. We've completed our initial accreditation many years ago. We've had our site visit. We continue to be accredited by ACGME successfully every year. I'm really proud to say we've never had a citation. We've never been on probation. We've actually demonstrated over the last decade that the program has been up and running, that we are successful at creating, maintaining, optimizing, and running a clinical informatics program here at OHSU. Next slide. And the educational model is validated. We know that fellows are satisfied with the learning that they get in the program. Our board success rate, as Bill mentioned, has been excellent. And most importantly, our fellows are able to find jobs after fellowship in the areas that they want to practice in, both clinically as well as with respect to the clinical informatics work that they do. Our environment is inclusive and collegial, and I'd mentioned that this is one of the family of programs at DMICE, and there's a lot of connection between our clinical informatics fellows and students at other programs, whether they are taking online courses together as part of their didactics, or whether they're participating in things like journal club or research conferences. And in fact, we have a fellows meeting that happens every Thursday for three terms of the year. And that fellows meeting is not just the CI fellows, it's the CI fellows, the NLM pre-docs, the NLM postdocs, the PhD students. They all come together to learn together, which I think is a strength of DMICE and who we are. We have diverse faculty that who are invested in the program and in fellows and in their learning. And there are a multitude of learning opportunities, not just multiple rotation sites, each of which has its own unique culture and learning environment, but also a multitude of didactic learning experiences, because we've been able to leverage our strong course catalog for all the other educational programs that we deliver, in order to make sure that our clinical informatics fellows have the best theoretical knowledge of clinical informatics that they desire. Very early on in the process, we realized that we could have one of two programs. We could have one type of program, and everybody who came out of the program was very kind of similar in their skills, their competencies, and their job prospects. Or we could bespoke the fellowship experience and try to make sure that the fellowship offered different things to different people, depending on what they needed, what their trajectories were, and what they wanted to achieve professionally as informaticians. It is more work to create a bespoke experience for each clinical informatics fellows, but personally, I think it's well worth it. It's something that the faculty shares, a philosophy that the faculty shares, and I think it has really helped us to deliver the best possible learning experience, individualized for each fellow in the years that we've been in existence. And of course, Portland is a unique place to live and work in. Everything you see in Portlandia about Portland is true. It is a great place, and I think one of the things that we've learned over time living in Portland is that it is unique, and there is no place like home. Next slide. So again, I don't want to go through each individual fellow, but I want to give you a sense of who our fellows are. We took our first cohort, as Dr. Hirsch mentioned, in 2015. Our first fellows were In-Ho Kim, who came to us after completing an emergency medicine residency, and Jim Morrison, who had completed an interventional radiology residency when he came to us. And since then, we have had a multitude of fellows. As you can see, we have taken folks who are trained in multiple specialties in internal medicine, ophthalmology, emergency medicine, pediatric neurology, family medicine, just to name a few. And if you go to the next slide, Lauren. The story continues. We take on average 3 fellows a year. Some years we've taken more, some years we've taken less, depending on where we end up with respect to things like funding. And in general, we are a subspecialty of all specialties. We take folks who are trained in any clinical specialty, and we convert them into clinical informaticians who are able to function providing informatics services in almost any clinical location and any healthcare environment. And in 2023, our 9th cohort is going to start in July. Michaela, Q, and Richie, who are coming to us from training in emergency medicine, peds critical care, and internal medicine, respectively. Next slide. And then again, this is just to give you a sense of how diverse and large our faculty is. Even though we only have, on average, 3 fellows per cohort, it's a 2-year program. So we have 6 fellows on average at any given time in our program. We have a large number of dedicated faculty who are either directly engaging with the fellows during their rotations or indirectly engaging them by teaching them during the didactics that they take. And as you can see, I have 2 associate program directors. One is Dr. Hirsch, who's with us today. Until recently, he was the chair of DMICE, and the other associate program director is Cord Garrison, who's our CHIO. That's our CMIO of our hospital. As you can see, leadership in informatics and the department is well represented in our faculty and our critical aspects of how the program is shaped and how services are run. Our program faculty come from different backgrounds. Many of them are physicians trained in different specialties. Ani, for example, is internal medicine trained. Eilish is a neurologist by training and a sleep specialist. But many of them are not MD physicians. Many of them are formally trained informaticians. For example, Joe Nash, who's one of the preeminent researchers in the field of qualitative research in informatics. Paul Gorman, who has spent decades in advancing the field of informatics. These are folks that our fellows will interact with on a regular basis. It's also really gratifying to see that some of our graduates who have continued as faculty at OHSU or in our partner sites are engaged in the program, continue to be engaged in the program, and interact extensively with our fellows. For example, Ani Chintalapalli, who's one of our associate CHIOs at OHSU, is a graduate of the program. Ben Orwell, who's faculty in Peds Critical Care, is also a formal graduate of the program. And Dajin, who has recently graduated from the program, is now clinical faculty at OHSU and does some of her informatics work at OCHEN, 2 of the rotation sites that you will be able to interact with her. And on the right side are DMICE faculty who teach courses and didactic courses. Many of them engage with our fellows, not just as instructors in the courses, but also if the fellows are doing a master and they require mentorship and advice for their capstone or research projects or for other aspects of their training. These faculty are available to our fellows not just on an as-needed basis, but many of them actually take a strong interest in the program and are associated with it. Next slide. And I mentioned our didactics. We have this huge course catalog that I would urge you to go take a look at. If you just do a Google search for DMICE course catalog, that's probably the first hit that you'll find. And so when we built the program, we decided to leverage this extensive body of learning into the ACGME accredited CI fellowship. All of our CI fellows complete a graduate certificate program. Many of them have opted to enroll in the master's program. Whether you do a certificate or a master's, in the time that you are a CI fellow, the tuition is waived by the institution, and I think that's a huge benefit of the program itself. Like all other ACGME programs, we have a rotation model. Our rotations are typically 8 weeks, and you may end up rotating at OHSU or one of our partner sites. At OHSU, you may have different types of rotation that may be operational, that may be related to analytics. One of our popular rotations is one where fellows rotate at our mission control, which is an entity that is responsible not just for capacity management at OHSU, but also during the COVID pandemic, they were critical in trying to provide the most efficient care at a time when our healthcare system was very highly stressed. In addition to OHSU, our fellows may also rotate at Hillsborough Medical Center or Adventist Medical Center, which are partner community hospitals, part of the OHSU family of healthcare organizations. They may rotate at the Portland VA, or also at OCHEN, which is a health information network. It's an organization that provides EPIC services to over 3,000 mostly primary care clinics and some specialty clinics as well, mostly in the outpatient setting. And they basically remotely deliver EPIC services to a lot of places which otherwise would not have an electronic health record. Next slide. And then some of the features of the program itself. And actually, this is one of my favorite pictures of the view from OHSU. This is from our campus looking down at the waterfront. You can see the cable car going down. This is, kind of early in the morning, kind of mist. That's one of the reasons I like to go in early on winter days, is to just kind of hang out and look around. Sometimes the conditions are good like this. But going back to our program features, our fellows lead many of the QI projects that happen not just at DMICE, but also, for example, if there's a resident in another clinical program who wants to do a QI project and they're looking for some informatics help or support, our clinical informatics fellows can act as consultants for them, which is a kind of a role that they would have in real life for their clinical partners. We also have activities such as regular journal clubs, regular clinical informatics grand rounds. On Thursdays, as Dr. Hirsch mentioned, we have a research conference that we hold for 3 terms of the year, where we bring in folks both from inside DMICE as well as outside the institution to talk about interesting topics in informatics. We have a set of sessions for the program that we call Meet the Expert, where we bring in folks mostly from outside OHSU who are interesting to the field of clinical informatics. And then our CI fellows regularly meet with Dr. Hirsch, with Dr. Garrison, who's our CHIO, and then with our associate CHIOs. And this is the equivalent of kind of the rounds that you would have with different faculty members in a clinical program. But every week, there's always some meeting with folks, usually that happens either virtually or on the big campus, although Dr. Hirsch is known to take the fellows out to a nearby restaurant for some snacks and some beer when he has his meetings with them. And then there's also other programming that enhances learning that we regularly introduce as part of our curriculum. Next slide. And this picture is actually a bit of the staircase going down from the top floor. And it's kind of, I think, representative of learning in informatics, where we keep learning about new things and we come up this flight of stairs, and every floor is new and it's different, and people are doing different kinds of things. And we have an opportunity to participate in universes that we could not dream of as clinicians before becoming informaticians. The program does take the effort to expose clinical informatics fellows to leaders. All clinical informatics fellows participate in committees and other leadership activities. They also have opportunities to do research, especially if they sign up for the master's program. And they participate in conferences which may be external, like the AMIA Clinical Informatics Conference or the AMIA Annual Symposium, where they participate not just in dissemination of knowledge, but also in fun activities like hackathons. The CIC meeting has a retreat for all clinical informatics fellows from multiple programs at the onset of the meeting. And fellows also participate in internal conferences at OHSU, like our Research Week, our Inventathon. And this is programming that is built into the schedule for clinical informatics fellows. I've already mentioned the strong program and departmental faculty that I think is a particular strength of OHSU. Additionally, clinical informatics fellows also spend about 20% of their time in independent clinical practice in their primary clinical specialty. And what we realized is that it doesn't matter what specialty, clinical specialty you are in. If you come to OHSU to do your CI fellowship, we make sure that you spend some time with your clinical department doing some clinical work, so that in the 2 years that you're a CI fellow, your clinical competencies do not wither and die, that you're actually able to be as successful as a clinician after you graduate from the OHSU CI fellowship as you are as a clinical informatician. Next slide. So I'd mentioned the academic day model. So 1 day a week, Thursdays, is set aside for activities that fellows do together as a cohort. We may start with a didactic or a journal club or some kind of plan programming. Every fellow will meet with me on a rolling basis once a week. And then at usually 11 o'clock on Thursdays, we have a program meeting where we sit down, and Lynn, who is our program coordinator, is with us. And we talk about some of the administrative stuff that we need to discuss, and that kind of sets up the DMICE Informatics Research Conference that our fellows attend. Some of those may end up being clinical informatics grand rounds, and then after they've attended the clinical informatics research conference, our CI fellows engage in the so-called fellows DMICE fellows meetings, where they're also hanging out with the PhD and postdoc students. And this is typically mentored by a couple of DMICE faculty, but the program is, the meeting is run by the fellows, not just our CI fellows, but all fellows, and the faculty are just there to provide advice and some input if needed. And then in the afternoon, like I mentioned, there's always some there's some activity that the fellows do one-on-one with faculty, all the fellows with one faculty. So for example, they may meet with Dr. Hirsch, they may meet with our CMIO rounds, they may have additional meet the experts sessions where they meet with experts. And actually this picture is on the 5th floor of the big building, which is where DMICE is. On the back of the building is this kind of large balcony, and it looks out. You can see in the back of the picture is the VA, and then to the left of the picture is the hospital, and then the white building in the middle is Dornbecker, which is the children's hospital. And pre-COVID, many of the fellows meeting used to be actually held in this balcony. The VA is to the east of Big, so I assume this is sunrise. So obviously not this early, but this is just to give you an idea of the kind of things that we do on a Thursday, which is our academic day. This is similar to the academic day model in many clinical specialties, but it has been adapted significantly for informatics. Next slide. So really what I want to end with is this idea of what does completing the clinical informatics fellowship at OHSU mean for you? And I want to talk about it at 3 levels. First, and most importantly, is the ability to gain an excellent fund of knowledge and develop the competencies that are required to be successful as a clinical informatician. And if you'd like to do something else, which is a little bit non-traditional, not just become a CMIO, but maybe go into academia, maybe go into industry. Some of our fellows have, expressed interest in going on to found their own startups. We have the opportunity, we may not have the opportunity to get you there at the end of 2 years. It really depends on your background and the skills that you need to be successful, but we can certainly get you on a trajectory no matter what your informatics course is. We can get you on a successful trajectory to get to the destination that you want to get to. Next slide. And this is Chuck Friedman's fundamental theorem of informatics, where Chuck said, a person who is working in partnership with an information resource is better than the person who is unassisted, who's working without that information resource. And this, I think, encapsulates what informatics is about. Our objective is to make you better by giving you the skills to work with those information resources and perform those tasks that will allow others to get better by giving them the right tools, giving them the right kind of opportunities in order to deliver better patient care. I think we get so enamored by the technology and the kind of interesting things about informatics, whether it is AI or machine learning, or it is NLP, or it is optimizing workflows, or it is doing all those things that we think of is really kind of cool about informatics, that we sometimes forget that at the other end of that kaleidoscope of fun things to do is a patient, and we need to make sure that healthcare delivery is optimized for them. And that's really at the bottom line of what we do as informaticians, is that we make healthcare delivery better so that patients can have better outcomes. It's just that we do it differently than we did as clinicians with a stethoscope or with a scalpel. We do it with the help of technology and information resources. But the goal is the same, is to improve healthcare. And hopefully, our philosophy is that we will give you the skills so that completing the clinical informatics fellowship at OHSU will allow you to be an agent of change that will help provide better healthcare delivery. No matter where you end up, no matter what department, no matter what your clinical specialty is, you will be responsible for improving healthcare wherever you are. Next slide. And then finally, I cannot end a talk without talking a little bit about World of Warcraft, which is where this slide is from. It's really about achievements, isn't it? I mean, we talk about professional achievements. If you had told me 20 years ago, and said, would you be doing academic informatics in the way that you are now? 20 years ago, I would have said, I have no idea what you're talking about, because my focus was entirely about, getting a clinical education, about becoming competent as a clinician, about becoming better as an internist. And so our first kind of achievement that we think about is to get into medical school, is to become physicians, is to realize that dream that we've probably carried around for a large part of our lives. And then we become grandmasters in first aid, right? We go into a residency and we discover the skills that we need and gain that achievement where we become competent in a clinical specialty. Well, my job as a program director of a clinical informatics fellowship is to convert you into a professional informatics grandmaster. And that is the next professional goal, where you're not just taking your clinical skills and utilizing them, but learning a new set of skills. Obviously, you're interested in informatics, which is why you're watching this or you're participating in this webinar. And so to me, how do you take that interest? How do you take that idea that you can use your interest in informatics to enhance your professional career, and how do you convert it into a professional career? That is what the Clinical Informatics Fellowship does for you. Next slide. And with that, this is my email address. These are pictures of OHSU, the campus. At the bottom left is a big building, and the red arrow points towards my office. So if you're ever in Portland and want to come by and see the campus and hang out and talk about informatics, video games, I'm up for it. And that is my presentation.